I'm a wildlife epidemiologist in the Wildlife Conservation Society, and today I'm going to introduce you the Health and Wildlife Knowledge, the HOG database. As you know, wildlife health surveillance data is complex. It can include many actors that are generating data using multiple strategies and designs. These different strategies and designs can involve different units, different data types, and different host types and species, and even hazards. Each one can actually collect different sample types that are associated with different diagnostics. Because it's complex, it is important to keep this data organized so we have a standard structure with a harmonized vocabulary that allows the data to be complete, arrives in timely manner to decision makers, and that it stays centralized to be accessible for any stakeholder that needs to have access to this information. Finally, this data have to have metadata in order to understand how it was generated for future reuse. So the idea is to move from data that is incomplete, lost, private, incompatible, or that has poor metadata into information that is findable, accessible, interoperable, and reusable, with the goal to support the implementation and operation of wildlife health surveillance systems, streamline data sharing in One Health frameworks, and finally support biodiversity conservation and One Health. The success of a surveillance system is dependent on a reliable process of data management. However, the reality is different for wildlife health surveillance. Actually, there are problems with data management. On the left, we have a paper that was recently published where they say that analyzing the trends of sarcoptic mange in wildlife and South American camels is difficult due to the limitations in data access, a lack of systematization across reporting agencies, and ambiguous prevalence reporting. This is 2025. So, a few years ago in Thailand, there was a survey conducted with different partners, and one of the questions was if having easy access to data collected by your own sector was a challenge in their jurisdiction, and 50% responded that often or very often. Furthermore, they were also asked what priorities making improvements regarding having access to data collected by your own sector, and 64% of them said that it was very important. So databases are relevant in this case because they can help centralize information using a standardized structure and a harmonized vocabulary. However, there aren't platforms that are easily available for users in order to improve their data management practices. So, for example, the World Organization conducted a survey where they asked the national wildlife focal points if there was a need for a national centralized database for wildlife disease data, if there was a need for an online repository for national data management, and if there was a need for guidance and support for acquiring or developing a national information system. For the three of them, most of the responses were yes. This is where we believe that HOC, the Health and Wildlife Knowledge Data Service, can address this gap. HOC is an effort led by the Wildlife Conservation Society with the continued input of a community of practice, the Wildlife Health Intelligence Network. You can find details about it on the link provided on the left. HOC is very important to mention that it's not a data repository, so we are not pretending or asking or requesting users to provide their data to everyone, but it's a ready to adopt global public good meant to encourage best data practices in wildlife health surveillance, where the data remains private in private organization accounts. So the goal is to improve how wildlife health surveillance data is managed. Instead of having organizations to generate their own databases and use duplicating and triplicating efforts in terms of expending money to develop these platforms, we believe that the community can share costs to maintain one specific platform that is available for everyone. However, when local funding is unavailable, our vision is that Global South users and indigenous people will have access to HOC at no charge. The platform has artificial intelligence supported translation to other languages, meaning making it very easy to translate beyond the Latin vocabulary alphabet, for example. There is an API in development in order to communicate with other data services, so we can get data into HOC from, let's say, other services that have mobile phones to record information, but it can also send data to, let's say, for example, One Health platforms. Through the institutional support of the Wildlife Conservation Society, an organization with more than 100 years, the data is safe because the platform is sustainable. Finally, HOG is a continuously optimized tool for public agencies, private organizations, academia, and other interested actors conducting wildlife health surveillance that is based on a community of practice feedback. So HOG Data Service structures the information in a multi-partner data model that is designed to manage this wildlife health surveillance data from different sources that are targeting different hazards or host under a unique structure. So it doesn't matter the variability of your data. The goal is that the structure in HOG allows to manage your information. So the mantra is that the database adapts to your data structure. You do not adapt to the database. So this is how the information is organized. We have a project, which is a set of initiatives under one manager, and then we have the project has different surveillance activities. The surveillance activities are initiatives in surveillance that have a specific objective and methodology, and they provide the metadata, how data or information was generated. Each surveillance activity is completed through field visits, for example, a specific period in the field. During those field visits, different locations are surveyed. And if those locations are surveyed through a specific effort, let's say exploration of an area or the walking a specific track, there is an effort that is also tied to the location. Then we have an event which can correspond to the detection, capture, or sampling of animals at the individual level or at the herd level, or sites or the collection of samples from sites that are providing environmental specimens or where arthropods are being trapped. So if the event is associated with, if that collection, capture, or identification is associated with an effort, there is a collection point. And finally, the event contains, through this collection point or not, source records. There are 4 types of source records. The first one is herds, when the surveillance is based on a group of animals of the same species. Animal, when the surveillance is based on individual animals. Arthropods, when the surveillance is targeting, for example, vector of diseases, let's say chikungunya in Southeast Asia, transmitted by specific vectors, or environmental sites that are providing specimens like water, soil, air, or sediment. Specifically for animals and herds, they can also receive a necropsy or receive a diagnostic for example, an X-ray using the full animal. From these sources, it is possible or not to collect the specimens. If the specimens are obtained, they can actually be used to run diagnostics, and this diagnostic receive a result and an interpretation. Based on the diagnostic interpretation, there is an interpretation for the specimen regarding the presence or absence of the hazard, and same idea with the source record. Based on the interpretation of the specimens, there is also an interpretation of the source record regarding the presence or absence of a hazard. However, the idea is that this structure remains modular. For example, if you are only making observations, you will not need a specimen diagnostic results and interpretations, and therefore these components will not be available for you in the structure. This is a beta of the graphical user interface, and what I'm showing you here is how currently the platform is showcasing the structure of the data that I was just describing. So in my case, I have different organizations because I am the administrator, but these are all mock organizations. Under organizations, we have projects. Once you select one of the project units, the fields associated with that project show up. There are 3 tabs. One is the details, the files associated with the project, and the map and tabular data. Under projects, we have surveillance activities, as I mentioned before, that are specific objectives with a methodology. Surveillance objectives can have field visits. Field visits have locations. Locations can be or not associated with collection tracks or collection areas if the identification of events contains an effort or not. Then we have the events that are the spatio-temporal location of the capture, identification, or sampling of animals, or trapping arthropods, or collecting environmental specimens. In this case, we see that the collection point has the 4 sources that I already mentioned. We are in the animal source showing here that has a source record when it's found or observed at time t. As you can see, there is a storage also or export processes involved, so you can track where the carcass of an animal is and the exports that have been completed with that carcass. And the source records also have the information if you want to add any necropsy in this case. And we are in the level of a specimen now that can also receive a diagnostic test. The tests have a result, and then, as I was mentioning before, based on those results, there is an interpretation associated, but also the specimens have storage and export information. So you can keep track of where a specimen was, where it is, and how, and the shipping process that it went through. So a couple of examples. Let's start with a project that doesn't have a specimen collection. So I'm going to say that my project is wildlife health surveillance in Reserva Maya. And the surveillance activity consists of screwworm fly surveillance. These are adult flies, and using trapping of adult flies through USDA traps. So my field visits are periods when the traps are deployed. These traps are deployed in a sector X within Reserva Maya. The events is the spatial temporal coordinate where the arthropod source is placed, meaning the location of the trap. There is an effort associated with the trap, and therefore I have to complete the number of traps with date traps data that are associated with that event. And finally, I have a source, which is the site where the trap is set, and the source record is the abundance of flies at time t. So in this case, I'm not even getting into the pathogen within a specific arthropod. I'm just actually taking consideration, or I am interested on the abundance of flies in the environment. And in this case, of course, because I am not collecting specimens or making diagnostics or conducting diagnostics, I don't have access to these last 3 components. In the case of an outbreak investigation, there is a specimen collection. In this case, I still have the same project, Wildlife Health in Reserva Maya, but in this case, the surveillance activity is about agro investigation, and the strategy is recording wildlife within an area with a detected mass mortality. And in this place, I'm going to collect samples from animals and the soil or water beneath them. So the field visit is each visit during that investigation. It could be, for example, each daily visit. The location is the sector X within Reserva Maya where the outbreak was detected. There is an effort regarding the exploration of an area in order to identify wildlife morbidity and mortality. The event corresponds to the spatiotemporal coordinate where the animals are found, dead, sick, or injured, or healthy. And then the source records are the animals at time t, but also the ground or water where the animals are found at time t. So I'm collecting a specimen from both sources. For the animals, I'm taking samples, and then from the environment, I'm taking abiotic tissue from the substract, and then these specimens are used to run different diagnostics, and I have a result and interpretation for each one of these diagnostics. One of the other things that the platform does is to have a specific standard vocabulary, and that vocabulary meaning options and body parts, histopathology lesions, hazards like chemicals or pathogens. They all follow a standardized and controlled vocabularies that are already been developed. In our case, we're using the AgroVoc developed by and maintained by the Food and Agriculture Organization of the United Nations. The medical subject headings maintained and developed by the National Library of Medicine and the National Agricultural Library Thesaurus as well. So how does it work? We believe the idea or the vision is that HOG is a one single platform where each organization can have their own accounts. In each one of these organizations, there will be a general administrator, which will have full control of these private organization accounts, providing access to users and different permissions to these different users. Therefore, there is data ownership. However, there will be self-selected embargoes at the surveillance activity level, so each organization must provide a limit when the data will become available. That can be immediately, it could be in 25 more years, but in this way, we believe we find a balance between data protection, but also availability for the future in order to have more information and make better assessments and conclusions. If you want more details, this is the manual, and we have a paper recently published that is showcased on the left. Finally, I want to thank the funding sources for developing the platform. This is my email, and I am happy to take questions and also help set you up the platform if you're thinking on establishing or implementing or operationalizing wildlife health surveillance on a national level or a local level. Thank you so much.